Welcome, everyone, to this episode of a special 5-part series of the Sunflower Palliative Care podcast. This is a collaboration between the Sunflower Children's Network and Canada's Pediatric Palliative Care Alliance. The series explores issues for equity-deserving groups in palliative care, including vulnerably housed and homeless communities, Indigenous communities, disabled communities, diverse socio-linguistic communities, and two-spirited LGBTQ+ communities. I am one of your hosts. I'm Camara van Breemen. I'm a nurse practitioner at Canuck Place and a volunteer director with Two Worlds Cancer Collaboration. Today, I'm so pleased to be speaking with Susan Poitras. She has been a clinician in healthcare for many years and currently is the Clinical Director of Pain 360 and Pediatric Palliative Care at British Columbia's Children's Hospital, located in Vancouver, Canada. Welcome, Susan. So nice to have you here.
Nice to be here.
Our focus today is exploring the interface of healthcare and the Indigenous communities. And I was hoping that we could start with a land acknowledgement. For those of you who reside outside of Canada, this has been a practice that we've been having in place for a number of years now, with really the focus on the ongoing and important work of reconciliation.
Thank you for asking me to do so. So currently, we're residing on the Coast Salish lands, which include the host nations of the Musqueam, Tsleil-Waututh, and Squamish nations. And in British Columbia, there are many, many more nations and communities throughout the whole province. And so as a tertiary center at BC Children's Hospital, we also acknowledge all the other nations and communities that we serve within BC and the Yukon. My position is a Metis Citizen of British Columbia, and my ancestral background is Cree on my father's side and European on my mother's. With this acknowledgement, just really wanting to be grateful and thankful for the stewardship of our elders that have passed down the wisdom for us to learn from, as colonialism impacts the healthcare that we provide and is insidious in our systems. For all healthcare providers here, that we really need to be mindful of being intentional and having active action to mitigate racism and discrimination.
Thank you so much. I really appreciate you setting that tone in terms of the impact of colonialism and how, yes, it's affected every aspect of their lives, healthcare included. So, as I've said, this series is about exploring the concepts and delivering equitable care. I'd love to hear what informs you as to the equitable delivery of healthcare for Indigenous communities and families. I think you've mentioned one already, that they're impacted because of colonialism, but what are the other things that get in the way of equity in delivering good care?
Well, there are many, many good documents that have been developed over the years now, and our call to actions through the Truth and Reconciliation document outline several actions in healthcare. I think the challenge around the system is that Indigenous people are confronted with a history and trauma related to their engagement with healthcare, with school, and with the government. And this creates a significant impact in their ability to trust and feel safe within our healthcare system. And with the sense of lack of safety, this then impacts their ability to access healthcare. And with the decreased access in healthcare, it then impacts their health. And as we know, the social determinants of health for Indigenous people is considerably lower than the average Canadian. And so from my perspective, the inequity would be, or try to right the equity, would be to have all Indigenous healthcare be at par with every Canadian.
So all those determinants of health be equal.
Yes.
Shelter, food, housing.
Yeah. Culture.
Education.
Mm-hmm.
Yeah. So we have a lot of work to do. Can you share a work and life experience perhaps that informs how you do your work? So you work in a big organization. You have lots of competing needs from children, from the perspective of children and family that are accessing pain and palliative care. What are some of the work and life experience that inform how you navigate this?
Well, I think I hold a few values. I've always held them as a nurse and a counselor and clinician in working with children and families. I think for me, self-determination and being able to honor the person's autonomy and preferences are at the center of care. And so person and family-centered care is a value that I really have, actively employ in my relations with people, with families when I work with them clinically, and also with colleagues when I work with them as a leader. I think palliative care, pediatric palliative care, person and family-centered care is at the core of its work. And also for pain care, because it's such a subjective experience, that you really do need to inquire and be able to listen and understand the person's perspective to be able to provide the care and assess them appropriately. And so I think inherently working with people who are in pain or are suffering or are coping with serious illness I've gravitated to it, I think, just because of my core values and beliefs.
So tell me a little bit about this work in pain and pediatric palliative care, and the intersections of caring and supporting families and bringing to examples, fostering, how you foster Indigenous cultural safety in that care.
Mm-hmm. Well, cultural safety is an outcome. So it's something that we're hoping the Indigenous person is going to feel. And that's what they have to say, that's how they feel. Yes. So it's an outcome. I think the action that we need to be mindful of as clinicians in healthcare across the board, but probably even more so with pediatric palliative care, is, that reflective practice of cultural humility, because, we need to be always reflecting on our biases that may show up in the moment, our naivety around the impact of colonialism on people, be humble when we're partnering with Indigenous families and communities about seeking their truth and also their cultural specific ways, because there's so many different communities and nations that have all different sort of nuances to their practices and wise practices and also their rituals and customs and blessings. So I think, practicing cultural humility and being humble, and also remembering the undertone of colonialism, and that there's still a lot of insidious systems in place that reinforce colonialism, and that we need to actively try to
dismantle
them. Yeah. Dismantle these barriers.
I love, the concept of cultural humility, and as you said, it starts with self-reflection of, what do I believe? What do I believe about this person or their circumstances? We often get a chart and we review the chart around a child and families with people's narratives. So their biases might also influence our approach. How do you do that as a clinician? What practices do you do when you sort of going to enter into the care of a child and family that perhaps people have already, quote unquote, labeled or decided or have power over?
Mm-hmm. Well, being a clinician in healthcare for over 30 years now, and as an Indigenous Métis person, it's been hard to reconcile sometimes. The identity that people hold and have around this Indigenous reconciliation work has been sort of more active more recently. And so historically for me, it has not been easy. I think that I have confronted discrimination from colleagues, from documents, from leadership, from the system and organizations. And so, to speak your truth and to stand up for that, it's hard, because I think in the past, people weren't as aware. I think now I feel safer to be able to say that I'm a Métis person. I often would not even self-declare that with my colleagues in the past. And again, the fear of feeling discriminated against and judged is always underlying. I think, when working with Indigenous families in the past, I've had to advocate strongly. I've had to walk with them in facing their personal fears and anxieties around the system, and really trying to connect them with practices and ways that are going to support them in being in an environment that's hard to be in. Trying to educate people and making them more aware about this perspective. Some people are more open to understanding that, and some people are less able to hear that right now, and that's a challenge. But yeah, it's a continuous advocacy, and also swimming against the stream sometimes to advocate for an experience of Indigenous people across this country where they have been raised to feel ashamed and also to feel second class. And that's not right.
You spoke about in the beginning about self-determination and autonomy. And when you couple that with shame or second class, it's hard to rectify that in a clinical encounter. And so as a clinician that's informed and has some power in the system to help determine and support what they want and for people to hear their voice is so important, but it is hard work.
Yeah, and there's, I think there's power imbalances throughout the healthcare system, and it impacts all families. But I think for the Indigenous families and the Indigenous people, that there is this additional layer with the colonial experience and also intergenerational trauma related to that. And it takes time for the healing to happen. Yeah.
We talked a little bit about your, individual clinician work and humility and self-assessment and become informed. What other systems have you put in place or you see that the healthcare has put in place to support Indigenous families, that they have access to more equitable care or advocacy?
Well, locally in British Columbia, I think our province has been a leader in developing awareness and also taking action to eradicate racism and also discrimination, and really trying to find healing with partnership with Indigenous communities and leadership. Within our province, we have an unprecedented First Nations Health Authority, which is no other. It's an organization that's about 12 years old. It was formed to help support Indigenous people with their healthcare experiences and also being able to address the social determinants of health and cultural safety. So right there, it's a very innovative, unique system that we have to have that.
And First Nations led.
Yeah, and First Nations led. I think in a lot of organizations and hospitals that they are integrating Indigenous health programs and also liaisons and also education. That's sort of mandatory within different health authorities. And I think that also has been a movement of change. The health authority that I work in, which is the Provincial Health Authority, has also partnered with First Nation elders and leaders to actually integrate values and teachings within their mission and vision. And again, really trying to integrate the partnership in a high-level way, just showing that commitment for everyone that is employed under the health authority. So those are a couple examples.
I'm going to go a little bit more micro again. And you also worked at Connect Place for many years as a counselor and a nurse with children and families across the palliative care spectrum, but also at end of life. I'm wondering if you can share a story about caring for an Indigenous child and family that taught you something, that impacted you in a way that helped you be a better clinician. I'm sure you're seeing quite a few little faces come to mind.
Yeah, flashing in front of my face. Well, there's a few that really do stand out. I think I'll just maybe talk generally about some of the general learnings I've learned from a few families, but I think for me, it's the beauty of family and community and the importance of that connection to feel culturally safe is so important. And working with different types of families with different shapes and different structures, and some children that are in care, really understanding that, that connection with their community and with their family and being able to preserve those connections really provides strength, and really listen to them. Mm-hmm. And sometimes like needing to be creative about how you're going to move a mountain to make that happen. Mm-hmm. Yeah, just thinking about lots of families. One family that really needed to fly home, and there's lots of anger about not being able to.
They wanted to be back in their home community.
They wanted to be home in their community. And at Connect Place, we really listened and heard that, and were brave and supported that. And the child got home. And that was so important for the family.
And I'm sure there was multiple barriers to doing that, right?
There were.
Yeah.
Multiple system, and also just the care of the child, and also the dynamics within the family. I think about, the reluctance about receiving access to care because of fear of children being taken away, and how important it is to build trust alliance and allyship.
I think inherently in pediatric palliative care, when your child is so sick and your child is, any parent wonders, am I good enough parent? Am I doing the right things? Are these the right decisions? And I can only imagine when you already come in with feeling judged, how that wall might go up. Are they going to judge my care, or am I going to be blamed for this circumstance? I imagine that is, whether consciously or unconsciously, with the families we work with. And you say building trust. Do you have a brief framework about how you might go about that, or give us some examples of way to enter into that room that there's trepidation of engagement?
Well, I think being honest and transparent is helpful. Do what you say, be authentic. Also, inquire first. So listen first, and then ask permission second about what pieces of information and things that they need to lead you in the relationship and also within their care. And again, trust takes time, and it's a process, and it only takes one thing to break it. So being consistent and continually practicing with cultural humility. And I think also there are things that are happening that are causing confusion, that there is a process of bringing people together to discuss. Because I think for Indigenous people and communities, having the support of their community around them, their elders, their family, to discuss things together and provide different perspectives actually gives them strength and helps them feel safer in the care. Like, I remember one circle I was in supporting a family in the PICU, and I think we facilitated having about 30 people in the circle talking about the care of this young boy, and supporting the parents and understanding what was happening and sharing the medical information, and then having the elder speak and having a blessing and a prayer, and then having opportunity then to sit with and pause before and having discussions and then be able to come back. So, giving that space for processing is important. And if we can, we should provide that.
I just love that example. For this family, their practice and their community meant that the clinical information, and often, in our society, we're about efficiency, clarity, back and forth. When, do it in 45 minutes, have a family team meeting. But for this family, what I'm hearing is they needed medical information, but they also needed a space for their spirituality right in that circle, and their traditions right in that circle. And they needed not just the doctor's wisdom, clinical information, they needed grandmas.
And aunties and elders. And
I can imagine that sometimes the system might be impatient with that.
It's hard to make space. Yes, we have, time is finite, and hospitals are busy places.
But in the end, probably this was more efficient than hitting it with a hammer.
The process was helpful. The family was able to feel supported in their decisions and also help the medical team know what their preference was. And so there was clarity for them too. This young boy, we didn't know if he would survive his illness. He did.
I have a couple more questions. I know I could talk to you for just forever, but I wonder, just in closing, if you had a wish for our healthcare system in Canada and improvements in equitable care for Indigenous people, what would be some of your wishes?
Well, I think for equitable care, that Indigenous people's rights would be respected and actively honored. There's many locations throughout our country where the basic needs around all the social determinants are not readily available, including drinking water, for instance, or accessible community care, or even minor primary care needs, and also, just the social pieces around culture, which again need to be infused and respected. I think would be that their rights are honored and respected, and that they actually are felt. When that happens, then equitable care is more accessible and available.
Got to start at the foundation. Anything else you want to share before I close?
For people just to know that it's a process of understanding, and you need to understand the truth before you can then be able to dismantle the inequities. and for people to get educated, to people to read. I was talking to a colleague that actually doesn't live in Canada, they live in Turkey. I was mentioning something about my background and my father and his experiences growing up and being a survivor of many difficulties when he was younger. And she wasn't really aware. And so she took it upon herself to learn. And she read up. And so I met with her recently. And she, before even we started our meeting, she said, I just want to say that after our meeting last time, I took it upon myself to actually do some research to understand what you were talking about last time. And she said, she goes, I just want to cry about understanding the history. There's been a lot of pain and a lot of hurt, but the Indigenous people are strong and resilient, and we're still here. Also, I think are really growing in our ability to help this world and help with the wisdom of our elders and the learning that we have had through all these transgressions.
As I'm listening to you, I'm thinking about our role in palliative care and in pediatric palliative care. And if we don't assess the suffering, we can't know what to do to help.
Mm-hmm.
And I hear that recognition of there was a lot of suffering, and the suffering actually is ongoing because of the inequities. So let's look at it. Let's see it. Let's acknowledge it and have compassion so that we can move together to create better care. Just as we would when we see a child suffering with an illness, let's incorporate that too in our assessment and our compassion for the families. Thank you so much. And thank you for listening to this episode of the Sunflower Palliative Care Podcast. The series on equity in children's palliative care is produced in collaboration with Canada's Pediatric Palliative Care Alliance with support from Health Canada. We look forward to sharing more from this 5-part series. To learn more about the Alliance, please visit pediatricpalliativecare.ca. The Sunflower Podcast grew from the seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The network is an initiative of Two Worlds Cancer Collaboration focusing on children's palliative care. We hope to build a world where no child suffers from serious health-related issues. To learn more, please visit twoworldscancer.ca. Thanks for listening, and we look forward to sharing the next episode of this series with you.